Hi, everybody. My name is Ashley Surratt. I'm a pediatric emergency medicine physician, and today I'm here to talk to you about effective interventions for health workforce well-being, what every healthcare professional should know. So, we all know that working in an emotionally and physically taxing environment for an extended period of time can lead to burnout. And even though burnout can impact any profession, it is becoming widely acknowledged as a serious issue for healthcare workers globally, particularly during public health emergencies, which we all witnessed during COVID-19. Burnout is a multifaceted illness. It's characterized by emotional exhaustion or feeling deeply overextended and depleted of physical and emotional resources. Depersonalization, which is when you start developing a cynical, detached, or excessively callous response to your patients and colleagues. And finally, a sense of low personal accomplishment at work where you're just feeling like you're making a lot of failures and you're not successful anymore in what you're doing. So, how do we tackle burnout? There are two ways to tackle burnout. We have individual interventions and we have institutional interventions. So, let's start with our individual interventions, peer support and debriefing, which actually have been among the highest rated in terms of effectiveness interventions for well being. And that's because they target workplace loneliness, emotional exhaustion, it promotes workplace engagement, adaptive coping behaviors as well. And there's something called the stress first aid model. This is something that is delivered by individuals without mental health training, and their goal is to mediate and mitigate the effect of atypically stressful circumstances that we deal with in the workplace. It uses a train the trainer approach where you have at least one trainer or trained champion per 50 workers. And the trial found that there was a protective effect, particularly in younger workers and under-resourced community health settings. So overall, these are great strategies, not only because they are simple and effective, but also they are low cost and they do not require any licensed therapist or expensive equipment. Now let's talk about our institutional interventions. This begins with collective management decisions, especially during public health emergencies. This is going to help lessen burnout among healthcare workers by making them feel respected and appreciated by their organizations. Adequate resources such as PPE and training on the management of specific infectious diseases will also relieve anxieties about contracting infectious diseases at work through patients and other staff members. Risk allowance. So institutions should provide a risk allowance for their healthcare workers as an incentive for the work that they undertake because they have a higher risk of contracting these infectious diseases versus the general population. This can be provided in terms of a monetary bonus or an in-person benefit that their loved ones can use if they die from contracting the disease at work. These in-person benefits might be family medical insurance, life insurance, or taking care of the family if something terrible were to happen or you are unable to work anymore. Task shifting is another great strategy that healthcare institutions should implement. This is going to help prevent overworking any one healthcare worker group during epidemics. And finally, to prevent any healthcare worker from being compelled to make any significant life or death decisions that may, in the end, only affect them and their mental health, healthcare institutions should establish committees that deal with ethical concerns. So, the strongest evidence is actually related to job and task redesign. It directly targets the resource imbalance that drives burnout. There should be some caution, however, to task shifting because any informal task shifting carries real risks for patients, staff, and management when job titles and rewards don't change and career progression is absent. For example, you've been tasked with much more responsibilities, and yet you are still getting paid the same, and you don't have any change in your title or your recognition. So, therefore, we can say that planned, compensated task shifting with training and supervision is protective, whereas unplanned, unrecognized task shifting amplifies burnout. Structural interventions such as flexible work and scheduling is going to allow schedule autonomy, shift optimization, and protected recovery time. Environmental interventions, that's going to include quiet rooms. It's going to include virtual nature, improved break spaces, noise reduction, and nature-based physical activity. All of these changes produce a decrease in anxiety and stress and depression. In fact, actual virtual natural environments can also provide remarkable improvements in well-being. And the dose is flexible. You might only need 10 to 15-minute exposures, and it's still going to give you measurable gains. Other highly effective interventions include gratitude writing, physical activity, hazard pay, and debriefing, like we mentioned previously, but we'll get into that a little bit more. Gratitude intervention has actually some of the most compelling data for a low-cost, rapid deployment tool. In a randomized controlled trial of over 1,500 healthcare workers, they noticed that focused gratitude letter writing produced significant improvements in emotional exhaustion, happiness, and work-life balance, especially at a 1 week follow-up. So maybe like a 10 or 15-minute moment of gratitude writing would produce a great change in even a week later. So it's a brief exposure, but again, it's going to show great gains in emotional well-being. Physical activity also was found to demonstrate decreased psychological stress as well as improved sleep quality. Hazard pay and staff debriefing, again, were the two most effective interventions, but they were infrequently used, which people found in multiple systemic surveys. Thank you cards and free food were among the next most effective, and daily email updates and motivational signage, the most commonly used interventions, really had below average effectiveness ratings. So, in conclusion, what we're noticing is that organizational changes have a greater and stronger effectiveness than individual programs alone. Individual programs do work, but there are limits. Peer support, we mentioned, it's simple, low cost, and high yield. Digital tools such as virtual natural environments, even short doses, is super helpful. And simple exposures, gratitude practices, just going outside in nature, all of those things can definitely improve well-being. And so we know that improved well-being equals improved patient safety. Burned out staff make more errors, and there's higher turnover and worse outcomes. So therefore, it's super important to invest in your staff, your healthcare workforce, in order to provide the greatest, the most safe environment for your patients and everyone working along with you in that environment. So I want to thank you for listening, and if you have any questions, I'm here to answer them. Thank you so much, and have a great rest of your conference weekend.